In the Cotswolds integrated community teams, our primary function is to enable people to live as well as they can in their own homes. And that is something that hasn't really changed given the COVID situation that we find ourselves in at the moment.
We have occupational therapists, physiotherapists, rehabilitation workers and nurses all going out to see patients in their own homes and doing all the complex cases that we always have done.
As a team, we go and see patients that are predominantly housebound, that are not able to get to their GP surgery for whatever reason. So we look after all sorts of patients, diabetic patients, we give insulins, we do catheter care, we do palliative care, we give injections.
So COVID has just given us an extra layer of complexity, really. We're still seeing the same people at home as we always would. We've had to change the way that we approach people. We're wearing all of our PPE.
We have to allocate more time for each visit now because obviously we have to wear PPE, which takes time. And obviously we want to protect the patient.
We've changed shift patterns, so a lot of the therapists are now working 8 till 8 shifts and we're covering weekend working, which we didn't do as therapists before. The nurses and rehabilitation team have always done that, but that's a big change for our therapy team. And for us as a management team, obviously we're trying to support those members of staff as best we can, but without having to be close to them. So we're doing a lot of our meetings via Microsoft Teams.
It's really important that we keep going to see people because their needs haven't changed throughout this. It might be that we see some people with more complex needs given that they've recovered from COVID, but actually people still have the same needs that they always have done. And we need to deliver the same level of care that we always have done, and that's really important.
The occupational therapy team are really looking at people's independence. Our role is one of rehabilitation, really, and we do that in many different ways. That can be through sort of normal rehabilitation or rehabilitation services. I got an email on Tuesday morning of this week from our Disabled Facilities Grant officer that he'd been notified that Peggy's stairlift had catastrophically failed. She's reliant on that, really because of her frailty, to get to the bathroom and to the toilet and to her bedroom upstairs.
I'm 101 years old and I shall be 102 this year. I couldn't live a life. I couldn't do anything without it. And I do like to go up to bed.
So we were able to come out the same day, do an assessment, make a recommendation for the grant, help her apply for the grant, get it successfully approved yesterday, and then the stairlift company have been brilliant. They've been able to come and fit it today. So within 3 days we've got a functioning new stairlift in for her.
So I was quite happy with what's happened. I'm very pleased with it. I'm very satisfied inside. It only affects you inside, you know, think, oh, that's goodness, that's all done, and someone's looking after it for me.
I was redeployed about 7 weeks ago, so I was quite nervous coming over to be redeployed. All the patients I'm seeing at the moment are very regular. I see them on a weekly basis, so they've got to know me. And having a good team who communicate well and support each other, along with a sense of humour, is very important.
The morale has been incredible given what we've been facing, and they're really pulling together and finding ways that they can support each other and keep each other going, which means that we can go into those patients and deliver really caring, compassionate care.
And you really feel like you make a difference to patients because you see them in their own home. You can see things that you wouldn't normally see on a ward, so if they need any extra help, that you can offer any other services you can tap into for them.
I think we've got a really strong team here who are willing to adapt and change. I think the big thing is that things are changing all the time. We've got great communication coming down from the organisation, and then we implement that however we need to within the teams. And actually, we're very well equipped. We've got all the right equipment, we've got the PPE, and we've got the team who are willing to be flexible and work with the guidance, and that's the most important thing for me.
They're supportive, they're flexible, they respond immediately to issues, and as a team as a whole, they've all worked together and they've been so supportive.
I can't even think of the words to say how proud I am of the team. They have been blooming brilliant in how they've coped with all of this. I couldn't ask for a more flexible, adaptable, funny, happy workforce, and thank you will never really be enough to say.